This is my dad. He's an orthopedic surgeon who works at a primary children's medical center. Even though many people are working from home now, he still goes into work most days. Every day, things are getting worse. Because, as people keep saying, things are going to get worse before they get better.
Since the pandemic started, things have changed significantly at the hospital. All elective surgeries have been shut down, which means that we have a significantly lower case volume of surgery cases. At a children's hospital, we haven't really seen the rush of respiratory cases like you might see in an adult hospital. And so even the emergency room was relatively quiet when I was there just a couple of nights ago. We know that at some children's hospitals in other parts of the country, the children's hospitals have been used to start treating young adults. And we know that in some situations, people who work in children's hospitals are being asked to go work in the adult hospitals to help with a large volume of cases. So the precautions that we're taking now are a lot different than even we were taking just a couple of weeks ago. There is a lot more visible hand washing, a lot more wearing of gloves. Then the newest thing, and I feel like this changes almost every day, the guidance that we're getting changes, is that I'm starting to wear a mask anytime I'm within 6 feet of patients or their families. I think my home life is a lot different than it was before in some ways because both of my kids are home now. And so we're really cautious at home with hand washing. We've got 4 people at home now. We're all sleeping in different bedrooms, trying to space out. We consider myself and my wife to be in high-risk jobs since we work with patients. At our hospital, the hospital is run by a really large health system. Most employees of the hospital are worried about their job, and are they going to lose their job, and will they make less money, and will they be able to make their financial obligations. But we are in a system, fortunately, that's really large and has a lot of reserves that will be able to backstop us for what we think will get us through all of this time. But we don't know that, so everybody still is a little bit nervous about that, I would say. And most people who do what I do and that I work with, we would rather be working. Like, we like being there, we like doing what we do, and not doing it seems weird to us. The main thing, honestly, that would help healthcare workers that people could be doing is really helps all of us, which is just to practice all of the rules that are being given to us by departments of health and people like Dr. Fauci. So it's really taking social distancing and staying at home seriously. It's really being good about washing your hands. And if we can limit the spread of the virus in the state of Utah, then we are able to better manage the volume of patients that we know we're going to get coronavirus. But if it's overwhelming the healthcare system, then that's going to be really difficult for everybody, not just the healthcare workers, but everybody in the state of Utah. So it's really impacted the number of patients that I see on a regular basis. So for example, this week, one of my clinics where I would normally see maybe 25 people, I saw 2 people. It's a lot different in terms of volumes. And I was on call 3 times this past week. So I was there to take care of any injured people that came in. And normally when I'm on call, I would do several surgeries every day. And of the 3 calls that I was on, I did 2. I think that I would hope that people take it very seriously right now, because the point that we're in with this in Utah is the point where we can really have an impact. I know that it's very tempting for people a lot of times to feel like it's just a virus, it's similar to the flu, and even some of our leaders have been saying things like that before. But the truth is it's much deadlier than the flu. And even if you're a young, healthy person, Young, healthy people still get this. Young, healthy people can still die from this. And young, healthy people can still pass this on to people who really can't fight it and won't have a good chance with it. Whether it's an elderly person in their family or it's someone in their family who has pre-existing medical conditions and doesn't have the good baseline health to be able to fight it. So I would just hope that everybody takes it very seriously right now, because 6 weeks from now it may be too late.